Yeah, hi. So my name is Nadeem Ahmed. I work in the IT industry in Hyderabad. This is my mother, Bashirun Nisa. She's age 60 above. So this case, it started somewhere around February, March of 25. My mother was having difficulty in swallowing, like even gulping down water. So we thought initially that it was pertaining to the throat. We visited an ENT, but nothing was fruitful. Then we just happened to visit she was having a thyroid as well. So we visited our specialist who was taking care of her thyroid. And he was the one who told us that, this is not just about throat, it's something more. It's better you just consult someone who is a specialist in the gastro field. That's when we got to know about Dr. Dattaram sir, and we got the necessary tests done, and we were able to decipher that it was not just a minor complication. It was hiatus hernia, not just a small or minor hiatus hernia. The overlap of the foot pipe, and the overlap was more than what we were anticipating. So, and she's above 60, so that was one of the major roadblocks that we had. It was not like she's a 40, you can just do a surgery and things like that. And she has myasthenia gravis as well. Myasthenia gravis, we all know it could affect the eyelid, it could affect the throat, it could affect any muscle in the body. Myasthenia gravis, it's a very major underlying condition. So that comorbidity also had to be taken into place. Her thyroid also had to be taken into place, and she had cold and cough as well. That also had to be taken into consideration. From March 2025 to December 2025, almost a span of 8 to 9 months, we were trying to resolve these comorbidities one by one. Dr. Datta himself has suggested us to visit our neurologist who helped us with the myasthenia, then the pulmonologist, and all this while he was with us, he was suggesting us, he was assisting us with the medication, because not being able to eat, not being able to swallow is not a small thing, right? Imagine not being able to gulp down water as well, right? So it's not a very small thing. It was something serious, and we we were on our toes because all these factors had to be taken into place. And then finally, in the beginning of December, we had a surgery done for us. Dr. Dattaram sir performed the surgery. It took around 3 to 4 hours. Uh, but thankfully, at the end of the surgery, I was able to talk to her when she regained consciousness. She was able to, communicate. She was able to walk. She was able to gulp down water slowly, from liquids to semi-solid food to solid food. It's been a journey, a total of 9 months. Sir has been with us. My mother has shown a tremendous effort from her side as well. She was always positive that okay, I'm in the right hand. That's the first thing anyone would need, right? Because you are having underlying conditions and you want to come out of it, so you are ready to put efforts from your side, and you expect and hope that you are in safest hands. And thankfully, everything went good. It's been 2 months, approx 1.5 to 2 months, since her surgery has been performed for hiatus hernia. Because the situation was, it's something that could have happened again. So that was also taken care of. The mesh was put into place so that the stomach again, it does not come up and does not overlap with the foot pipe, right? So that was also something. He could have just performed a surgery and said, okay, we are good, but he took into consideration that this should not be happening again tomorrow, 1 year down the line, 2 years down the line, 3 years down the line. That today she is 60, tomorrow she might be 65, and if that case comes up at that point of time, it's not something that you would want. So precautionary measure wise, the mesh was also put into place. The surgery was done well. Everything is good. 1.5 months, 2 months, slowly she is recovered. Her stitches have been recovered. Things are good right now. So if you as well are looking for a solution to your hiatus hernia or any other consultation pertaining to gastro, I would undoubtedly recommend. I have already recommended my friends and families to sir. So I would again go out and say that thanks to Dr. Dattaram sir for being yeah, the journey of 9 months from approximately February, March, and up until December, and even after the post surgery recovery period, sir was with us throughout this while. So if you are someone who's looking for solution, to be in the correct hands to help you with your hiatus hernia or any other surgery pertaining to the field of gastro, I would highly recommend you. I've already recommended to my friends and family, and I would recommend you as well to visit sir. You can find his details. Anyone, you can just search Dr. Dattaram, and you will get him on Google. He's everywhere. He's active, right? So do reach out to him. The way we have come out of this major complication with so many comorbidities, so many complications, age, hiatus hernia, myasthenia gravis, pulmonology problems, everything was thankfully taken care of. He's someone that you can definitely trust. He has knowledge and he is human enough to understand the human essence of problems, and that patients are patients. We are humans at the end of the day. We need that human touch along with knowledge, and he's the best combination of both. You will be definitely be in safe hands. So just go for it. Go ahead.
वही बोला कैसे है अम्मा जी आप?
हम बेहतर हैं, बहुत बेहतर हैं पहले से। अच्छा है, सब खा पी सक रहे हैं, सब बेहतर हैं पहले से हम बहुत बेहतर हैं।
पेट दर्द वगैरह कुछ नहीं है?
नहीं कुछ
खाना खा सकते हैं?
खाने का भी कुछ प्रॉब्लम नहीं है, और खांसी वगैरह कुछ भी मेरे का कुछ प्रॉब्लम नहीं है।
सर्जरी के बाद का भी
सर्जरी के बाद भी पूरा जो करे थे पूरा ठीक हो गया, सब ठीक है, मेरे का कुछ परवाह नहीं। अच्छा फिर 1.5 मंथ में बिल्कुल ठीक हो गया। डॉक्टर साहब मेरे को बहुत अच्छे से देखे, बहुत बहुत शुक्रिया उनका भी।